Hi guys, I'm Sarah. I work at the DLVC. Today we're going to be doing a procedure called venous freeze. So first off, we always make sure that the patient's face is nice and clean. And then we're going to continue on with a nice little hair accessory to kind of throw her hair back. So I'll have you put that on.
Thank you.
So as a protective barrier, we put ultrasound gel all over the face. And it's just because the venous freeze emits a lot of heat. Now she's had a few previous treatments done with us before, so she kind of knows what to expect. And what's nice about this treatment, it's FDA approved for skin tightening. It can help with wrinkles, tone and texture, what have ya.
Have you noticed results from your previous treatments? I have. My skin feels a lot like cleaner and tighter and like smoother too. The texture and it just is completely changed, especially the day after.
All right, so we're gonna set this at 53%, and then we apply this directly on the face. The most important part of this is just continuing to move. You never want to sit in one spot just because of how hot it is. So we have her kind of like lay back and relax and enjoy the ride.
And how long is a typical treatment?
Usually lasts or takes about 20 to 30 minutes, depending upon the surface area in which we're treating. So if we're doing the neck, stomach, something to that extent, it's about 20 minutes, but if we're doing the full face, it's 30. So there's radio frequency actually coming out of these little handles right there. So it's heating up the tissue, stimulating collagen and elastin. In certain areas, you want to be gentle around the orbital bone, chin, and forehead. And throughout the treatment, I generally ask the patient, how's the heat? Making sure everything is tolerable. If you wouldn't mind describing what this feels like.
Feels like, I mean, with hot stones, I always say that, but it just is, it's not too hot. It's like kind of like a hot bath, like if you get into a hot tub, that type of temperature, and then it's just literally like little stones that are, you know, all lubed up and stuff.
Then throughout, I like to reapply the ultrasound gel just to make sure that there's a nice barrier for her, because as she explained, those rods do get very warm. And obviously you want to heat up the skin, but all within toleration. Like I explained, this is great for fine lines, wrinkles. We use this for cellulite on stomachs. It takes about 4 to 6 weeks for you to start really seeing the results from this, but as she explained, her skin feels great the next day.
Can patients get results in a single treatment, or will they need multiple treatments?
You will get some results from one treatment, but we generally like to package these for the sake of, throughout the years of doing these procedures, we've just noticed that you get the best results with, say, a package of 4, because generally you get about a 25% improvement with every treatment.
Could you please focus on the chin and jowl lines? Just
Most
because
certainly.
I'm concerned about those areas.
Most certainly. And that's primarily why I've been focusing on those areas. So with this, obviously just taking off the ultrasound gel, making sure that the skin's looking good for the day. Don't want to send her out with all that on her. And then what's nice is there's really no recovery from this procedure. There's a little bit of redness, which usually goes away pretty quickly within 20 to 30 minutes.
And how's your skin feeling now that it's all done?
It feels tingly. It feels tingly and firm at the same time.
And there she is.